Bismillah ar-Rahman ar-Rahim. First, I want to express my deep gratitude to Professor Nagia Fahmy, the pioneer of neuromuscular field in Egypt, and congratulate her for the great success of this distinguished conference and the whole neuromuscular chapter as well. Now we'll start our session. The first speaker will be Professor Nabila Hamdi from German University of Cairo. She will present the establishment of an ALS registry in Egypt.
So good afternoon. It's my pleasure to be with you today. And first of all, I would like to thank Professor Nagia Fahmy for this kind invitation to talk about our next dream and milestone in ALS, which is the establishment of an ALS registry in Egypt. This talk falls under the umbrella of collaboration between the Neuromuscular Unit at Shams University and the German University in Cairo that has started in 2017-2018. And let me start with reminding you of the ALS, complexity of the ALS, based on its clinical heterogeneity, but also a mysterious physiopathology that is not well elucidated, genetic complexity and heterogeneity, and an obvious variable epidemiology across the regions and populations. The good news is that the first gene-based therapy is approved for ALS for a subgroup of ALS patients having the SOD1 mutations, and with the advances of antisense oligonucleotides, we expect other treatments in the near future because there are several treatments in the pipeline. However, the genetic or the genes associated with ALS, they explain roughly 50% of the familial cases and only 10% of the sporadic cases. This means there should be other factors or other causes and mechanisms and risk factors that should explain or could explain the occurrence of disease in many patients. And for these reasons, the establishment of ALS registry is crucial to allow us to study all these hidden features of the disease. So if you look at the definition of registries in general, this is an organized system that uses observational study methods to collect uniform data, clinical data, and other data to evaluate specified outcomes for a population defined by a particular disease, condition, or exposure, and that serves predetermined scientific, clinical, or policy purposes. So the registries, in general, they offer us a real-world view about the clinical practice, the patient outcomes, the safety, cost effectiveness, and other features that would, of course, contribute to decision making. When we talk about registries, we need to differentiate between the hospital-based registries and the population-based registries. And of course, the population-based registries are more powerful because they offer us a holistic analysis on the level of the population rather than a cohort or a referral series. So that's why the population-based registries are extremely important for such complex diseases, and I would like to share with you some brief updates in Europe, because European countries are pioneers in the field of ALS registries. And the story started with the establishment of the European Neuromuscular Center, the ENMC, in 1990, which is actually an initiative to coordinate several activities in motor neuron diseases, like clinical trials, research for diagnostic markers, to uniform treatment guidelines, scientific publications, to uncover disease mechanisms, and translate basic research into treatment, and also to coach researchers in their mid-career. And although this initiative started as a European initiative, it expanded gradually to include clinicians and researchers from all over the world. So it is basically a worldwide network. And focusing on the ALS, the European ALS Consortium, the Urals, was established actually in 2004, and this was supported by the ENMC. It included 6 European countries, Scotland, England, Ireland, and 3 selected regions from Italy. And this was doable because these countries, they had already well-established registries for the disease, and they pooled the data from these 6 countries. And they found already interesting data that the features of the disease they obtained from ALS population, they are different from the data obtained from the referral series. For example, patients from referral series, they showed younger age at onset. They are less likely to present bulbar onset with higher proportion of familial history and longer survival. And here, of course, we have a risk of referral bias, which is a type of selection bias. Another interesting observation is the difference in the phenotype among the same European population, because they found bulbar onset is the predominant one in Ireland versus the predominant spinal onset in Italy. This is an observation that was not explained, and this shows actually that the disease could be heterogeneous even within the same continent and the same population. So the message here is the divergence of valuable disease characteristics with populations could be largely masked in case of reports and case series, and this shows the importance of establishing population-based registries. So let me update you with the geographic heterogeneity of ALS, which is one challenge in ALS research. And in order to study this geographical heterogeneity, there was this interesting and large study published in Lancet Neurology in 2018, which aimed at assessing the global and the regional and national burden of motor neuron diseases in the period between 1990 and 2016. And the aim actually was to understand how the prevalence, the incidence, mortality of ALS change over time, and by location is crucial for understanding the causes of the disease and for healthcare planning. So this study included 195 countries from all over the world, and they analyzed different motor neuron diseases, including ALS and SMA and other diseases. So they classified the countries into different levels of SDI, which is socio-demographic index, which actually reflects the development of the countries. This means countries with high SDI, they are well developed, and countries with low SDI, they are under development. And the first interesting finding is that they found a high incidence in the countries with high SDI. And this could be explained by overall improved survival, population aging in these countries, definite diagnosis, and a good public awareness. And then the second interesting finding is that they found a correlation between the SDI and the burden of the disease. The burden of the disease was assessed by the DALYs, which are the disability adjusted life years, okay? They found that the highest burden of the disease was found in the high SDI countries, and then a lower burden was found in the high middle SDI countries, while the lowest burden was found in the low SDI countries. However, when they compared the regions from Asia Pacific, which also has a high SDI country, versus Europe, they found differences among both populations. They found a lower burden in Asia, with a different genetics and different clinical characteristics. And they thought maybe there are risk factors that would explain these differences. However, this GBD study, Global Disease Burden Study 2016, they analyzed 84 risk factors, and they didn't find any sufficient evidence of association between these risk factors and the motor neuron disease incidence or deaths. This means the message was that there must be the role of other factors such as the race, ancestral origin, and other unmeasured risk factors that could explain the population differences. So we have now 2 questions to tackle. The first one, are demographics, phenotype, and outcome of ALS influenced by ancestral origin? And the second question is, do environmental and occupational risk factors differ across different ethnicities? And to tackle this important topic, There was a study that is recently published in 2022, and do show another initiative to establish another network for ALS in Latin America, so LINALS. And this initiative was supported and endorsed by the European experts from the European Consortium. This study included three countries from Latin America: Cuba, Uruguay, and Chile. And the aim is to do a comparative analysis of ALS epidemiology between the three different American populations, and to compare this data with large European reference data set for ALS. And already they found an interesting difference regarding the mortality rates, which were significantly lower in the mixed population than in the white population. This study also lays the ground to study gene-environmental interactions, and it represents a rich data set of admixed populations for later comparative genomic studies, because the integration between genomic studies and epidemiological studies is very important. And such initiatives, they might contribute to the development of novel therapeutic approaches and personalized medicine of all ALS patients in the different populations. So, another interesting aspect about the geographical heterogeneity of ALS is this interesting study that studied the projection increase in ALS from 2015 to 2040. They included 10 countries, and the dark blue bar represents the expected weight of the disease by 2040. And this increase, as you can see, in Europe it is 20%, around 30% in the US, and 10% in Japan. However, when you look at developing countries like Libya from Africa, it is over 100%, same trend or prediction for Iran, and 46% for China. And the message here is that the weight of the disease will gradually shift from the developed countries to the developing countries. And this, of course, which have huge implications and impact on healthcare policies. So that's why experts are now much interested in the populations or the continents that are not that well studied. And of course, our concern is with the African continent. So what do we know about ALS in Africa? Reports about ALS epidemiology and the features of ALS are lacking in Africa. Only in 2012, this was a review of the literature covering 35 studies. They were published to tackle the juvenile and adult onset MNDs and ALS among Africans, to study the incidence, phenotype, survival. This was an initiative from the TROPALS collaboration, which is also a European initiative to study the ALS under the tropics. And the first findings were the male-to-female ratio, 2.75, which is higher than the European ratio. Early onset of classic ALS, 50 years lower than the European data, with the occurrence of juvenile forms of ALS and MND. However, no data are available regarding the incidence, the mortality, and no prognostic factors. Only the few data about the mortality, they were retrieved from studies conducted in other countries on patients from African origin. And they showed that overall there is a lower mortality among the non-white patients or population in comparison to the white population. And then later in 2018, and this was also an initiative from the TROPALS collaboration, the first multi-center hospital-based cohort study was conducted with the aim of studying the clinical features and prognosis of ALS in Africa. So the TROPALS invited some countries from across the continent, so from North Africa, Algeria, Tunisia, from Western Africa, Mauritania, Senegal, Burkina Faso, Togo, and Benin, and from Southern Africa, South Africa. So in total, there were 9 centers from the 8 African countries in the period 2005 to 2017, and in total 185 ALS patients were analyzed. Standardized questionnaires and homogeneous methodology was applied, and socio-demographic and clinical features were analyzed, and for the first time, the survival times were also analyzed. And these are the relevant data from this study. Male to female ratio 2.9, age at onset 53 years, the bulbar onset almost 22%, the median survival time was 4 14 months from diagnosis and 35 months from disease onset, which is similar to Europe and North America. Still, no data on incidence was provided by the study. So, recently in 2021, there was a 4-year prospective study about the incidence of MND ALS was published from South Africa. And overall, the age and sex adjusted incidence rate was 1.67. However, when they classify the patients according to their ancestral origin, they found that the highest incidence was in the European ancestry group, 2.62, versus the lowest incidence was in the African ancestry group with only 0.56. And this is again highlights the role of ancestry. So a few words about the ALS management in Africa. This is a recent study from 2022 about the clinical management and disease-modifying treatment of ALS in African hospital centers. The same African countries, they have contributed in the TROPALS study. And as you know, the ALS needs a multidisciplinary care for optimal treatment and management. And that's why you have the multidisciplinary care was studied across the 9 centers, okay? And as you can see, neurologists, physical therapy, and psychologists, they were available in all centers. However, if you look at the respiratory therapists, for example, they were only available in half of the centers. And if you look at the palliative care, it was only available in 3 centers. So in summary, this multi-center observational study concluded that there is a low degree of implementation of multidisciplinary care in ALS management in Africa. Riluzole was only available in centers from 4 countries. It was unaffordable. The adjusted price was highly variable among countries, and the costs of treatment was partly or fully covered by patients, which represent, of course, an economic burden. And the message is that local and international collaboration is needed to improve ALS healthcare access in Africa. So coming now to Egypt, and when we talk about ALS in Egypt, of course, we talk about the Neuromuscular unit of Ain Shams University and Professor Nagia Fahmy, because it is the specialized and comprehensive unit of neuromuscular disease established in 1996. It is a referral tertiary center for all neuromuscular diseases with multidisciplinary teams for diagnosis and treatment, specialized laboratories, histopathology, immunohistochemistry, muscle biopsies, with biobank for muscle biopsies and biological fluids. It has a weekly myology clinic and around 50 outpatients every week. The unit is also active on research with national and international collaboration with both public and private centers, and it is also one of the main centers for gene therapy SMA, and it offers continuous education and regular training, as we are witnessing these days through the school and the conference. So preliminary data from the neuromuscular unit of Ain Shams University shows that the male to female ratio is 3.7, which is higher than the German registry and the European registry. Age at onset is much younger, 40 in comparison to 65 in Germany and 64.4 in Urals. However, we still don't have data about the incidence rate in Egypt, and other features they have to be, or they need to be further tackled, like, for example, the phenotype distribution, the survival rate, genetic risk factors, other environmental risk factors, and other features, and this would be only possible through the establishment of a population-based registry. However, if you would like to go to the classic cohort studies, we will face several limitations. Okay, the first limitation is because ALS is a rare disease, so we will need many millions of participants only to diagnose a few affected individuals. So you can imagine the duration of the project, it will be extremely long. In addition, the clinical complexity of ALS will require good expertise for diagnosis and for follow-up. So this means this initiative or this method would be very long in its duration, high costs, especially in the absence of dedicated funds for ALS registries. So that's why experts in the field, they suggested a cost-efficient method, which is the reconstructed cohort design. as a method to study rare diseases in population-based settings. And the principle is to reconstruct a theoretical cohort using case information from a well-defined geographic region collected through a surveillance system. This means if our aim is to calculate the incidence rate, so we need in the numerator the incident cases. So basically these are the individuals diagnosed with ALS in a well-geographical defined region. And in the denominator, we need to consider all individuals at risk living in the same area in a duration of time. And this is possible, this approach is possible. Why? Because in the denominator here, we can actually neglect the number of ALS cases in the general population because it's a rare disease. So simply for the denominator, our requirement would be the statistics of the regional demographics at a certain point in time, which relies on proper census data of good quality, which is luckily present or available in Egypt by the Central Agency for Public Mobilization and Statistics, the CAPMAS, and the Ministry Planning. And Egypt has also a previous experience with registry through by establishing the National Cancer Registry Program. So we can have support from the colleagues in the public health. For the numerator, of course, very crucial is to capture all cases of ALS as much as we can. So to maximize this exposure, of this capture of ALS cases, of course, we need to establish an efficient network of diagnostic facilities with sufficient expertise in neuromuscular diseases. The number of facilities will depend on the disease and healthcare system. In our case, it's a rare disease, so we don't expect to have many facilities. And the nature of the healthcare sector here, system in the country should be also considered. And we know that Egypt, it has a pluralistic and complex slide and a complex design. And that's why ideally we need to tackle all levels of the healthcare system by integrating this collaboration between the teaching, university, hospitals, specialized medical centers with private sector, public sector, and the research centers. And so this initiative, it's an open invitation for the experts and for the colleagues from the other centers to join this network. This is a dream for now. However, we are optimistic because we have already a solid background of national and international collaboration. And we will have the support of the European Consortium and experts from Germany that will help us in this important initiative. Thank you very much.
I have a comment, please. Okay. شكرا دكتور أحمد جمال، دكتور أمال على وجودكم معنا النهارده. Thank you, Professor Nabila Hamdi, Professor Pharmacology and Toxicology in GUC. الحقيقة احنا اتجرأنا في 2017 وبدأنا رسالة ماجستير، وكنا بنعمل يعني انتي بوديز عشان نشوف النيوروفيلامنتس في ال ALS، لكن لقينا نفسنا بدأنا نعمل ريجستري ال ALS، ودي كانت أول مرة نشتغل. فوجئنا إن إحنا عندنا large number of young patients, even children. I have 10 years and 12 years with classic ALS. في الوقت نفسه دكتورة نبيلة كانت عايزة تعمل genetics of a rare disease like ALS، فالشغل بيننا توافق، فبدأنا على أساس كذا رسالة ماجستير ودكتوراه في الGUC وفي عين شمس، منهم طبعا دكتورة رضوى سليمان معنا النهارده، ولقينا نفسنا بنعمل registry clinical وكمان بايو ماركرز، بناخد DNA ونشوف. يعني الحقيقة فوجئنا بإن إحنا ممكن نطلع بداتا تساعدنا في الباثوجينيسيس وتساعدنا في الثيرابي. إحنا لقينا فاميليال كيسز ولقينا فيهم حاجات اللي هي الSOD1 ميوتيشن ليها دلوقتي اكسون سكيبينج ثيرابي اسمه توفارسن، ده FDA approved. If we treat our patients very early، بدأنا نلاقي إنه ممكن يبقى في environmental factors، nutritional، occupational. طيب إحنا هنعرف عيانيننا إزاي؟ فالحقيقة كان بروفيسور جان كارلو، هو نيورولوجيست من إيطاليا، لكن هو رئيس انستيتيوت كبيرة قوي epidemiology، فابتدى إن هو يحط لنا الستراكشر وإن إحنا إزاي ممكن نعمل. هو كان الأول رأيه نعمل population based، طبعا أنا قلت له in Egypt مستحيل البوبيوليشن based، لكن قلت له هو ال ALS بيروح فين؟ ال ALS بيجي لنا إحنا هو عايز اكسبرت نيورولوجيست. فال اس هيروح لليونيفرسيتي هوسبيتالز، للريسيرش، للانستتيوشن، للانشورنس، يعني لازم هيبقى عايز اكسبرت نيورولوجيست. فاحنا ممكن عن طريق اللي هو حاطه الكونستراكشن اللي هو حاطه ان احنا نبتدي نشوف عيانينا. هيبقى لينا ذا سيم شيت، هيبقى في بيرسون اور تو مسؤولين في كل يونيفرسيتي هوسبيتال، ولازم نعرف عيانينا هم ايه. فده الحقيقه عشان كده انا يعني انفايت الدكتوره نبيله ان هي تقول لكم على الانيشيتيف دي، واحنا بدانا نعمل بابليكيشن لاول ريجستري. وانا بدعوكم يعني الحقيقه زمايلنا في البريفرال نيوروباثي والباركنسون، علي شلش والمنصوره دكتوره ايمان، عملوا شغل حلو في الصعيد. فانا الحقيقه قلت اعرض عليكم الانيشيتيف دي. شكرا لكم.